Kalidas. And Dr. Kalidas is the director of the Division of Headache Medicine and Associate Professor of Neurology at the University of South Florida in Tampa, where she serves as the Fellowship Director of Headache Medicine. She received her medical degree from the Ross University School of Medicine in Portsmouth, Dominica, after completing an internship in internal medicine at Long Island College Hospital in Brooklyn, New York. Dr. Kalidas subsequently completed a residency and chief residency in neurology and a fellowship in headache and facial pain at the University of South Florida. She is board certified in neurology with subspecialty certification in headache medicine. Dr. Kalidas' research has focused in therapies for patients with such disease as migraine, multiple sclerosis, and cluster headache. Her work has been published in such journals as Expert Review of Neurotherapeutics and Headache, the Journal of Head and Face Pain. I would welcome Dr. Kalidas, and I will now turn it over to you. Thank you so much.
Thank you, Katie. Thank you everyone for being on today. I know weekends end up being filled with many other things to do, so I appreciate everyone being on here. I'm really excited to be able to talk about some non-medication options. Dr. Maldonado was doing a fantastic job covering the new landscape of available migraine treatments, and it is so exciting to be able to now talk about some non-medication options that are available. So I am sharing my screen with everyone. Is everyone able to see my screen? Katie, can you maybe give me a heads up that you're able to see what I'm doing? Yes, okay, fantastic. Okay, so here we are, we're talking about non-pharmacological management of migraine. So basically focusing our presentation today on behavioral approaches, devices, and then nutraceuticals. Many of you in the audience, I recognize some names and some faces, really are probably pretty aware of many of these, but I am a big proponent of use of the typical medications that are approved for migraine prevention and rescue, in addition to using these non-pharmacological agents, and typically recommend some form of these for all patients. I think they're particularly helpful for patients who have significant side effects to medications or limitations to available treatments, or have a preference to remain non-medication. And then some of them certainly are safe during pregnancy and lactation, which we know are challenging times where we truly want to limit the amount of exposure to the fetus and to the newborn baby. So certainly a lot of room to implement some behavioral approaches. And so today, among the behavioral approaches that I'll talk about, they'll include relaxation training, temperature biofeedback, EMG biofeedback, and then cognitive behavioral therapy. So relaxation training is really there to help to modify headache-related physiological responses. So what do we mean? We mean that the body has a response to the fact that the pain is occurring in the head. They can be elevations in heart rate, they can be muscle tension that can happen, they can be guarding, which is where we're having pain, so we're kind of holding our muscles and our shoulders tight, which then can trigger further neck pain. And so really what relaxation training does is it helps to decrease the activity of the nervous system, decrease muscular tension, and really train us as individuals to achieve a relaxed state through a series of muscle exercises and controlled breathing. So in a way, it sounds like yoga, and there may be some components of that, but truly this is relaxation training where you get increased awareness of how to control your own body changes that can cause headaches for you. Biofeedback has some very similar components to it, except that we're using electronic equipment to measure and feedback information about our physiological functions. So basically, what does this mean? During pain, our heart rate can go up, our muscle tension can increase. We also can have elevations of temperature in our hands with increased sweating. So you get feedback from a machine, which basically, as you're modulating your heart rate, as you're modulating your muscle tension and modulating your hand temperature, you're getting feedback from the machine of those changes occurring which teaches you how to identify what your body feels like when those particular changes happen, and how you are then able to remember over repeated time with practice to be able to bring those particular changes for your body by yourself without having that particular device necessarily close to you. So essentially the goal is to balance your autonomic system, which is your fight or flight system, and your central nervous system, which is where our head pain particularly occurs. So there's particular biofeedback that's for hand warming, and then others for muscle relaxation and muscle tension. There are multiple studies which have taken place time and time again, showing that biofeedback is effective. And there's been a new resurgence in use of biofeedback because of the fact that we have handheld devices, we have apps available now, easy to download things that can be done. And what studies have shown is that it is effective, and there's a strong treatment effect that persists for over 12 months after training. Typically, this is more accessible these days than it used to be. And you know, when it comes to affordability, I think it varies. There's some insurances which are very good about covering it. You do need a prescription, and generally it is very, very low risk. I mean, sometimes some patients feel that it worsens their migraine. That is a rarer occasion where I do see that, but it is low risk and certainly affordable. There are some home biofeedback devices. The one on the left there showing how you would control your temperature, and then others for heart rate. So certainly it has, the technology has come a very long way to be able to help with home biofeedback as well. Sorry, excuse me, my allergies seem to be acting up here. So we also have cognitive behavioral therapy, which is another behavioral component that could be incorporated. And sometimes patients are very hesitant when I bring up cognitive behavioral therapy, in that, well, you know, I'm not crazy. This isn't, I'm not making this up. This is a real thing. And I believe you, it is. But cognitive behavioral therapy has a different focus than just saying this is all stress. Stress is part of that component. But more than that, it helps you to adjust your lifestyle. It talks about sleep. We talk about pacing, where patients can understand that, yes, you know, I have 15 things on my to-do list today. I can't possibly get all 15 done and think that that's not going to cause a migraine. So how do you pace your day so that you're still able to be effective, but not have to end up suffering a migraine at the end of the day? It also helps us to accept that this may be our new way of living. Sometimes when we go from episodic migraine to chronic migraine for no reason at all, we can't identify a trigger. That is a very, very stressful thing. It's stressful on the individual, it's stressful on the family. It has financial impacts. It has impact on your career. So this may be a new normal of having to have more days of pain than not. And how are we going to get through these days? And that's what cognitive behavioral therapy will help patients work with. So really, really more than just saying you're crazy and you're making this up, because that's not what any of us ever think, but really helping to recognize and cope more effectively with headache triggers so that we can prevent headaches and decrease the headache-related disability. So those are some behavioral techniques. And then acupuncture is kind of an in-between. It's not a device, but it's not a nutraceutical either. So I've kind of put acupuncture and physical therapy here next. There's a lot of data related to acupuncture, but some of it is positive, some of it is negative. I think it is likely to be effective. Typically, something I recommend, generally requiring 6 to 12 sessions to be effective. Not usually covered by insurance, but occasionally you can. A lot of times veterans do have very good access to acupuncture because that is offered within the veteran medical system. And the cost may be prohibitive because it's about $70 to $100 per session in our local area, and that's generally out of pocket. So that could be up to $1,200 to be able to get the full benefit. And then sometimes you may need these kind of refresher battlefield type acupuncture sessions again, which can be again needing an out-of-pocket cost. So I think there is a role if we've tried and failed everything else and are having significant challenges with medication to continue, consider and maybe even continue acupuncture. When it comes to physical therapy, this helps with identifying mechanical triggers. So most of our lives are now set in front of the computer as they are today. We commonly think we're doing the best that we possibly can with posture and, you know, not using our head and shoulders as much, and having an ergonomic way of doing everything. But sometimes we think we're doing the right thing and we may not necessarily be doing that. So physical therapy certainly has a role to be able to refresh us and help us to identify some of those mechanical triggers and help to identify our world modifications. Also, it works in gentle joint mobilization, helps with myofascial release. Essentially, what this is saying is that muscles can get tight, they can develop scar tissue in particular areas, and this can cause pain. So we help to be able to break all of that up. And the good part about physical therapy that I am a big proponent of is that it helps to teach you the skills. And this is a lifelong skill. So you'll be able to use this whenever you particularly need it in order to be able to manage your pain. I think that trigger point massage and trigger point release are very, very, very beneficial because, again, this is what you can do for yourself to help to manage your particular region of pain. A lot of times patients will say that my neck pain begins neck pain causes my migraine, and there's a large subset for whom neck pain does cause migraine. But the way the pathways work that Dr. Maldonado was referring to in her initial slides, the pathways of migraine extend from the middle of the brainstem, which is in the back of the brain, all the way down into the middle of the neck. So certainly we would expect that if that whole pathway is activated, that neck pain can be part of your pain, even if your neck is completely normal. So certainly learning some good trigger point massage and trigger point release techniques with a physical therapist can go a long way. And then light strengthening and conditioning can help to improve postural component. There have been studies which have shown that physical therapy and actually some degree of aerobic therapy can be as effective as using Topamax or propranolol for prevention. So that again goes a long way to say that, yes, I have my medication options, but if I could implement some non-medication options, I may be able to have better control. So this is a really good pictorial covering referred pain patterns for areas of pain. So certainly if you have pain that's happening in your forehead, like we see here in this particular area, particular picture, your pain could be coming from your neck. It may not necessarily just be coming from your forehead and your nerves there. So certainly keeping in mind that even sometimes when we develop jaw pain or facial pain, it can refer to other areas, including the forehead. And then here we're seeing how if we have it in the particular portions of the neck, it can radiate up into the back. If it's another area lower in the neck, it can radiate all the way up to the top of the head. So certainly very, very many different areas here, suggesting that we have referral pain patterns of our trigger points. And so necessarily where you're experiencing your pain isn't always where it generates. And physical therapists can really work hand in hand with you to identify how to navigate these with a non-medication component. There's another technique used in physical therapy commonly called the Graston Technique, which really is an instrument-assisted technique where they work on soft tissues where there's some scar tissue and there's potentially been some injury or maybe even some persistent activation. And they use these instruments to help to break up that muscle abnormality that's going there, and generally works best in combination with myofascial release. So these are just some techniques to keep in mind. Physical therapists have many, many other tools in their arsenal, but these are the ones which I have found to be most effective for patients. So moving from our behavioral techniques now to the devices, focusing today only on non-invasive neuromodulation, we're going to talk about supraorbital nerve stimulation with the Sefalume device, vagus nerve stimulation with GammaCore. We'll talk about single pulse transcranial magnetic stimulation with the Anora device. And then we have remote electrical neuromodulation with the Neurovio Migra. So some of you may be very familiar with these particular devices, but I find that these are a great complement to what we are already using. And fortunately, the data surrounding these have been very, very encouraging. So Sefalume is known as the supraorbital nerve stimulator. And basically the theory behind this is that the frequency of the stimulation is essentially inhibitory. The device, since its initial launch, has come a long way so that we now have one device with 2 settings, and it can be programmed to be either acute or preventative. So acute meaning that as you're actively experiencing your migraine pain, you can use it for up to 60 minutes to acutely manage your migraine pain. And then for prevention, which is a 20-minute treatment used daily to decrease the number of attacks. So this is called the Sefalume Duo. And the data has been really, really encouraging that basically when we look at the acute medication, after about 2 hours, 52% of patients saw a decrease in their pain intensity. So if we look at this compared to the medications that Dr. Maldonado was talking about, she was talking about, some of the medications giving between that 50-60% pain relief data. So this is kind of comparing to that when we look at, 2-hour pain relief. This is really, really encouraging. And then when we talk about prevention, we're having a decrease from an average of 6.9 days to 4.8 days. And about 38% of patients had a 50% improvement. So again, very encouraging. The studies were done very robustly. Certainly, I have had patients who had amazing results with this. And then as it is with any other treatment available, some patients have not had very good results. So certainly here, what I do think is that tingling, pain, and increased headache may be potential side effects. You do require a prescription that does need to be, I think, uploaded, faxed in, mailed in, and you can order it from the website called cefalume.us, and the price ranges between $450 and $500. It is expensive and unfortunately difficult to be able to just do a trial with it, but certainly something to consider. The next device we'll talk about today is called GammaCore. This is what we call the non-invasive vagal nerve stimulation, also approved both for prevention and acute treatment of migraine. This also requires a prescription. There is some insurance coverage, and cash pay, unfortunately, remains very expensive at about $595 per month. The last time I checked, I had a hard time getting this exact number from insurance from their website yesterday, but my last knowledge was it was in that between $500 and $600 range. And here again, they looked at a lot of different time points of data, and what they found that about 30% of patients are pain-free at 2 hours, and about 47% of patients can have pain relief with use of this medication at 2 hours. When we think about prevention, the longer patients use it, the better the results for prevention. And what they found was that at 8 months, there was a decrease by 7.8 days. So what this device essentially is where we're using the device and we're applying it to the portion of our neck, kind of where our vagal nerve goes. This is cranial nerve 10, and it provides all kinds of information about our heart rate. It is involved when we pass out sometimes, changes happen there. And what you're doing is you're essentially stimulating the intensity of the stimulation to the vagus nerve, ultimately sends feedback into the brain, helping with pain. There is quite a science to being able to use the device, but there are wonderful videos online to be able to help with use of these. So here's the protocols of how you do them. For prevention, it's basically 3 times a day. It's 2-minute stimulations 3 times a day. And then when you do it acutely, it's also 3 2-minute stimulations, which can be 20 minutes apart or 2 hours apart. So certainly encouraging here that it's up to you to control how you're going to be able to use this particular device. We also have transcranial magnetic stimulation, or the single pulse TMS, which is manufactured and called Anora. This device has come a long way. Previously, it was a very heavy 5-pound device that was much larger, but now you can see that it's a much smaller device, and this is basically delivering a dose of an electrical current to the occipital region, where Dr. Maldonado had talked about the cortical spreading depression, which starts with migraine with aura. Basically, this is a wave of activity that extends from the back of the brain moving up and ultimately triggering pain. So this transcranial magnetic stimulation is truly indicated for migraine with aura. And this data, again, shows pain freedom data in the 30% range at 2 hours, which really rivals what we see with a lot of the triptans and some of our new as needed medications. So again, very encouraging. And then pain freedom rates going out to 24 hours here at the 34 to 17% range when we look at using it as needed. When we look at it for prevention, we're seeing that about 2.5 fewer days of migraine happen each month. You do need a prescription for this, and this is essentially a rental from the company for $750 for 3 months. So again, pricing is on the higher side for both of these last 2 devices, certainly, but worth considering if we're having significant challenges with medications. Side effects are headache, dizziness, and upset stomach. Moving on to our next device called the Wren device, which is also known as Neurobio Migra. This is a very, very interesting device, and I've actually had quite a bit of personal experience with this as a person who suffers with migraine for many, many years of my own life, and we have a very strong family history of migraine. Both my grandfather and his twin had migraine, my father does, my sister does, and I do too. I'm always in search of something that's non-medication, and this one was particularly appealing to me because it is kind of controlled by your smartphone with this very sophisticated device with a chip located in this patch that is ultimately applied onto your arm. And essentially the theory behind this is that it works by activating your own endogenous descending pain pathway. So this little device here that you put onto your arm, you start it up with your smartphone, it's Bluetooth enabled. You started within an hour of onset of your migraine pain, and the duration of your application is 35 to 45 minutes. And what it does is that it is, to a certain degree, inducing discomfort into the arm, activating your own endogenous, your own intrinsic, your own pain pathway that normally can modulate pain. And so essentially what we're seeing here is that about 67% of patients had pain relief after their 45-minute device application. So really, really encouraging in terms of its efficacy. And that is what I saw. That is what I experienced when I use this device. I do get significant pain relief. I would say that I don't always get to 0 out of 10, but definitely from that 7-8 zone, getting me down to a 1 or 2, which certainly many days is very, very acceptable to me. The cost of this device is $99 for 12 45-minute treatments. So you can use this band up to 12 times for 45 minutes. So really, really encouraging. You do need a prescription, and this does need to go through a special pharmacy to be able to be dispensed. Okay, so moving on to Nutriceuticals. Katie, just remind me if I'm doing poorly on time, but I think I have about 10 minutes left, so I should be okay. We'll talk about the specific agents, magnesium, vitamin B2, and coenzyme Q10, and melatonin. Magnesium has long been used for many different conditions. We've been using it for migraine for probably over 20-25 years at this point. And magnesium is really involved in nerve hyperexcitability. It is involved in the mitochondria, which we suspect is involved in the migraine pathway. It helps to stabilize nerves. And it's suspected that in patients who have migraine, there may be a low intracellular level of magnesium, and the circulating blood levels are typically normal. So what ends up happening is that we have low intracellular levels of magnesium. So when we measure our blood levels of magnesium, those don't really tell us what our intracellular level is. And getting that measured commercially on a normal basis is very, very difficult. So even if your magnesium level is normal, you could still have a deficiency, which may be contributing to migraine because the intracellular level, which is used by the nerves to function, could be low. The recommended doses are really between 400 to 600 milligrams. There seems to be some additional benefit to using the citrate version versus the oxide version because of absorption. But certainly we do think that if you use the oxide version because that's all you can tolerate, that's okay too. We tend not to use Any that tends to cause a lot of GI upset for patients. So I recommend starting low at 200 milligrams and then gradually increasing. You can go as high as 1,000 milligrams if you wanted. The level of evidence, according to the American Academy of Neurology, is level B. So certainly A is the best, level of B tends to be better, and then C, and then U. So it's kind of in between, and I think that it's rather on the benign side, so less likely to cause significant long-term problems. So we also have riboflavin, which is also vitamin B2. This is also involved in energy production for the mitochondria. Recommended dose at 400 milligrams a day. There were many studies conducted, many positive, but there were some negative studies. One of the side effects is yellow urine, and it has a level B evidence per the American Academy of Neurology. We are not in favor of use of riboflavin typically during pregnancy because it does affect some pregnancy testing as well. Coenzyme Q10 is also involved in cell energy metabolism and studied at doses of 100 to 300 milligrams. I am generally recommending patients to use between 150 milligrams to 200 milligrams daily. There are definitely some positive studies, and patients tell me that it really helps with their level of energy as well, so certainly worth considering. And it also has a level B evidence per the American Academy of Neurology. Feverfew is a plant, and the dried leaf dosing is at 125 milligrams per day. It does take a while to become effective, up to 6 weeks. And it does have some potential GI upset side effects. Avoid during pregnancy, and there is some variability in how you can find it. Some associated with ginger, some with vitamin B2, some with magnesium. So very many different settings in which you can get this. And I actually bought the plant. I went to a kind of a botanical show, plant show at some point, and ended up buying the Feverfew plant and tried to eat it a couple of times daily. It's very bitter to just eat the leaf off the plant. So I'm not sure that that's the best way to go. There are some concepts out there of making teas with them, but I think getting it in a capsule formulation is probably much better tolerated. But I was so excited when I saw the plant that I was like, oh, it doesn't matter. I'll give it a try. How bad could it be? But it is quite bitter. So I would really recommend using the capsules rather than the dried leaves. Melatonin is well known to many of us as a sleep aid. This helps to decrease inflammatory markers, and the dosing is recommended between 6 to 12 milligrams 1 hour prior to bedtime, and you may dose as much as 3 to 4 hours prior to bedtime in order to get the full benefit. There are few side effects. There are concerns about the formulations because not all formulations are consistent, so I would certainly recommend getting this from a reputable source. And then I have gotten many questions over time about daith piercings. And, you know, I think that if you're okay with piercings, you particularly like them, that I see no reason not to do them. Have I seen dramatic improvement in patients? Probably not. The theory behind this is that it works on an acupressure point, which is part of the same areas that acupuncturists work on. Many patients have gotten this and feel that there's at least a decrease in their intensity of pain in those particular areas. So certainly worth considering if you particularly don't mind it. I've heard it's a very, very painful piercing because it's into the cartilage compared to like piercings into the earlobe or other places. But certainly something that's non-pharmacological and patients do ask us about. I didn't focus much on, you know, tracking symptoms and addressing meals and fatigue and sleep, but those are things that we should be doing from the non-medication side. The apps that I recommend specifically are Migraine Buddy and Migraine Monitor. I find that they're easy to download. They're free apps. Patients have good ability to be able to create summaries at the end of each month or between office visit times, which have been helpful. I recommend really avoiding triggers that cause a lot of fatigue, skipping meals, bright lights, strong smells. I really am not into recommending like a ketogenic diet. But I do recommend a preservative-free diet, so fresh fruits, fresh vegetables, lean meats and proteins. Consider eliminating your food triggers, or work with a dietitian to help you to identify some of those triggers. I am not someone who says just eat, brown rice and then gradually introduce everything in. That is not how I function. I think that if you, for example, eat pizza and then you have a really bad migraine, eliminate all the ingredients from pizza and then gradually reintroduce them and see what ended up triggering your migraine, and that is probably a trigger. So it is challenging, but definitely worth doing. Consider supplements like magnesium, vitamin B2, and CoQ10. Consider working with a psychologist or a counselor who can help with stress management skills and helping to adjust to whatever your new normal may be. Consider acupuncture, biofeedback, and physical therapy. And then consider use of those neuromodulation devices, though there certainly are definite constraints related to cost with these devices, and we certainly understand those, but they are now available. Sometimes I tell patients, maybe put that on your Christmas list. So instead of getting, gift card somewhere, many family members can pool together and sometimes get you one of those devices, which may be helpful if it's cost prohibitive. So that is my slideshow, and that is my presentation for today. I am happy to field any questions at this time.
Thank you very much. That was very informative, and I like the suggestion for a Christmas list. That's a good idea. Pull your whole family together to get you one of those devices.
Yes.
Maybe. That was a good suggestion. Okay, I'm pulling up the questions right now. Okay, let me see. Okay. Oh, I know. One you had mentioned that pain brings body temperatures up and you get hot and sweaty. But can it also make you cold? It always seems that I get very cold during migraine.
Absolutely. And everyone's body responds differently to any kind of physical stress. Some people will actually have sweating, they can feel their heart rate go up, the hands get really clammy, and other people will feel that actually their blood has moved from everywhere from the extremities away, making them feel very cold, sometimes blue fingers. You can even get the feeling of chills during a very severe episode of pain. Absolutely. So it can go both ways. Yeah.
Okay. All right. Is physical therapy covered by insurance, and do you need a prescription for it?
Yes, physical therapy generally is covered by insurance. It's very rare for it not to be. Sometimes your copays can be on the higher side, but yes, you do need a prescription.
Okay, and covered by could be covered by a copay. I mean, could be covered, and then you'd have a copay.
Correct. Yes.
Okay, I have one actually. So, talking about all these devices you have. A lot of times I see things online that actually I have one up because I took a picture of it from Facebook, and it's like a device, and it's called neck bliss, and you put it on your neck and it has massages your neck. Mm-hmm. Is that similar to devices and helping, they all claim helps your
right.
helps this. And, I've never bought anything, but I've always wanted to ask my migraine specialist. So now you're on talking about it. So
perfect. Yeah. So, I think that there's so many devices out there that it's challenging to be able to know which one to purchase. I recommend that I would go where the evidence is. We have a lot of good data with the devices that I talked about today. They are unfortunately expensive as well. I think that if you feel like you need a little neck massage, physical therapy is a good idea. And you could also use this device that you're talking about. But I would go with ones that we have good data on, because I think if you go and look at some of these studies, there's an ice hat as well that a lot of people talk about. There's other ones which are other stimulators, which are supposed to be helpful. There's like another claw thing for the head that people talk about. So there's very many out there. I think the ones that us as headache specialists tend to prefer are the ones that have good quality studies with a good amount of data affiliated with it. Because the last thing I want you to do is spend $200 or $300 on something that has no clear data, and then it's just going to end up being packed away in a closet. So I recommend really focusing on where the data is before deciding on what you're going to buy. And always ask your provider, whether it's your primary care doctor, your pain management doctor, or your neurologist.
Sure. Spend another $300 and get the one that, you know, has the migraine background.
Correct. And these have been designed with science in mind. They're looking at the pathophysiology of migraine. They're looking at the intrinsic, what we normally already have in our body to be able to manage the pain.
Right. Very good. Thank you. And we have, okay, so they had suggestions on migraine trigger apps, and I think you gave those, right?
I did not give you any apps for those.
Or, yeah, migraine trigger apps. Okay.
I can't remember any apps off the top of my head right now, but I did give you the trigger point locations. And I tend not to recommend that you do these on your own without any kind of training. You really need to work with a physical therapist in order to be able to learn how to do these techniques first, rather than just using an app on your own. I really would discourage doing that independently at this point.
Okay, perfect. So for that question, she would suggest seeing a physical therapist, and then I would assume a physical therapist would probably have a good app to suggest
Exactly.
for that. Okay.
Because everyone's body is different, and the last thing you want to do is start doing something that could adversely impact you.
Very good. Yes, thank you so much. Lastly, there's a comment here. GammaCore vagal nerve stimulator is also approved for use in those who have cluster headache, the only one of the non-invasive medical devices.
Correct, yes.
Okay, perfect. Well, those